Welcome to Medical Billing Advocates of America. We hope you enjoy the following presentation on becoming an advocate. Upon conclusion, should you have any questions, please don't hesitate to contact us at 540-904-5872, or you can reach us by email at info@billadvocates.com. Over the years, providers and facilities have had the luxury of charging whatever they choose for services rendered and anticipating that payers will pay whatever they are asked to pay. This very practice has led us to the healthcare crisis that we face today. As stated in many media interviews, the charges affixed to healthcare services are not a price that healthcare providers expect to receive unless the patient is uninsured or underinsured. We are all reminded daily of the effects the economy has had on consumers and today's businesses. Unemployment is rising, individuals are struggling to find jobs, and businesses are downsizing. With the economy in the present state and the potential to get worse, individuals and businesses alike are looking to cut costs and save money anywhere they can. And reducing healthcare costs is the one area that can do just that. This is where we step in. The worse off the economy is, the more healthcare advocacy is in demand. Our healthcare system is out of control with fraud, abuse, and inflated prices. Before, only the uninsured and underinsured were driven into bankruptcy. Today, patients with healthcare coverage are going bankrupt. A study done at Harvard University indicates that this is the biggest cause of bankruptcy, representing 62% of all personal bankruptcies. One of the interesting caveats of this study shows that 78% of filers had some form of health insurance, thus bucking that myth that medical bills affect only the uninsured. Do you think the health reform is going to make a difference in your life? One thing is for certain, it will increase the need for our advocacy services, and there can't be a better time to get involved. Look at the rippled effects that occurred when the U.S. government put their hands together in an effort to provide prescription drug coverage to its citizens and rolled out a plan called Medicare Part D. The controversy over that was implausible. Patients are paying with their lives, whether insured or uninsured. Consumers are delaying or not seeking the medical attention they need due to extreme health care costs. This is a great opportunity to have a career in a field that is so rewarding and satisfying. The markets available for potential clientele are unlimited. Our services are beneficial to anyone that is a payer in the healthcare industry: consumers, self-insured businesses, unions, health insurance companies, auto and homeowner carriers, attorneys, and state and government municipalities. Whether your goal is to start a new business or broaden your company's ability to provide advocacy as a new service, you will gain the knowledge and specialized skills needed to be successful. Providers and facilities can be very creative with the descriptions listed for the items and services that appear on itemized bills. Here are just a few examples of non-billable items we see on a daily basis. Non-sterile disposable latex gloves at $53 a pair. And yes, folks, these are the gloves that the physicians use and throw away after your visit. Oral administration. Do you recall the white cup the nurse hands you with your pills in it? The charge for this is $12 each time, and it does not include the cost of medication. And lastly, we have the famous cough support device, a teddy bear that is given to you after surgery. However, you aren't informed there will be a fee for it. These are all non-billable supplies and are billed and paid by most patients and insurance companies. More costly overcharges result in double billing and unbundled charges. Double billing is billing for the same item or service twice, using different descriptions or codes. A common error we see is for the use of cardiac cath procedure room at $24,000 and an operating room at $8,000. That can be very costly. The practice of unbundling is using different codes to identify procedures that are normally covered under a single code. A common error of this is billing for the insertion of a cardiac defibrillator at $33,000, which includes the procedure room and the defibrillator, and the facility also bills separately for the defibrillator at $57,000. NBAA advocates detect fraudulent and abusive billing practices based on NBAA's proprietary training methodology. The error rate on medical bills is estimated to be at an astounding 17 to 49%. Medical facilities and providers have used revenue enhancement practices so much now that it is a way of life for them. To think that medical billing will ever become true and accurate and fair and reasonable without the presence and the force of advocates is highly unlikely. To sign up today and gain the qualifications and skills in this highly demanded field of patient and healthcare advocacy. Start your career today. Request our free information package. If you have any questions, don't hesitate to call our office, and a specialist will help you determine if this career is for you.